morning, everyone. Thank you for being here. Thank you to our guests. We have a lot of guests today, so I know what we did well or what we did bad. But anyway, we can get started. Here at the City of Laredo Blue Ribbon Committee for People with Disabilities, today is Wednesday, March 19th, 2025. We can start by having the minutes for January 15th approved. So you look at, you can please go through the minutes that are attached to your file, please. So are there any changes, corrections?
Can you hear us, Ms. Brumley? Can you hear us, Ms. Brumley?
Oh, select the microphone? Maybe the top one?
Okay, third tries a charm. Can you hear us, Ms. Brumley? No?
Put those in the chat.
Yeah, I had chatted that we were in streaming services. Okay, so when we move on.
The minutes were approved. Third item is our public comments. Did anybody sign up for public comments? Maybe you didn't, you didn't.
Right now?
Sure.
Well, I just wanted to share that I had gone to the library after the last meeting to request an author to come to Laredo for Autism Awareness Month, which is in April, and it's for, it's Carrie Magro. And so Ms. Ordonez,
Sorry.
Ms. Ordonez was letting me know that, that she's aware of this author. And the librarian let me know that it is a big possibility for him to come in and speak to parents about things that are available to them. He goes through his own journey how his parents struggled with him and, you know, what they did. And he includes a lot of information in this book about, everything from physicians to therapies to, places where you can take your child for camps and things like that. And it's a lot of information, and I thought it might be a good idea. Just wanted to share that. Hopefully, they'll come in.
So if you were to come to Laredo, would some kind of financial arrangements need to be made with him?
Some kind of a what?
Financial arrangements?
It would be through the library. They have the funds to sponsor an author.
Okay.
But they don't advertise for that author. They only provide the room and his fee. Everything else would be, you know,
Outside media.
you know, yes.
Okay, just wanted to find out. I'm sure that was covered. Okay, the next, any other public comments, or? No? Okay. We can move on to item number 4, discussion possible action. We're talking about old business now, review of the presentation provided by City Secretary regarding committee training. The committee training that we attended, primarily was done through PowerPoint, and so we had asked if we could go ahead and, Angie, thank you for getting this, for locating it and for providing it to us. My understanding is that this, she can provide it to anybody in the room. If you all didn't get a hard copy, you can provide it to you via email. So just want to let her know, she can send it to you. The pamphlet's kind of large, okay, so I think that probably, and I don't think that anyone's had the opportunity to go through it, so maybe it would be a good thing for you all just to take it home and read it, and then we can discuss any specific item that you all want to go over and review.
Was this the training that was at the library?
At the library.
Yeah, this
Yes?
is the
Oh,
training
okay.
that was at the library.
Okay.
Yeah, but we had asked for the material itself, and we kept getting referred to the actual entire presentation.
Oh, okay.
So we were asking, is there any way that we can acquire the actual PowerPoint presentation only? And so this is what it is, and there's a second part that there was an attorney who also, I think this is the ethics portion as well. So that's a coming out 2 pamphlets. Yes. Old business committee members, updates regarding their advocating to state legislators for installation of a psychiatric hospital as requested by the police department. Okay, this was, when we spoke to the Laredo Police Department, that we went to see them and we visited with them. One of their biggest concerns was that when they have a psychiatric crisis, they don't have somewhere where they can just drop off the individual. They've got to transport them to one of the local hospitals, one of the emergency rooms, and that person needs to be medically clear. In the meantime, the mental health authority has to identify if he needs to be hospitalized, he or she. They have to find a bed throughout the state. It can be a public institution, it can be a private institution, wherever they can find a bed. And sometimes that delay or that wait can take literally days. In the meantime, the person's having a psychiatric crisis, and the police is being shifted through their shifts to take care of this individual until they're able to transport him out of town. And so their request is that there be a psychiatric hospital, and there's already an inpatient unit in Laredo. My understanding is the inpatient unit does not take individuals who are either they're violent, and so that's one of the criteria, that they don't have the manpower or the capacity or the structure to safely house individuals that can be a danger to themselves or to others. And so one of the reasons why we're moved to San Antonio is for that very reason or somewhere else, is to place them in a hospital that has that capacity. And so the hospital, the police are asking that it would be very convenient and much more time saving, cost saving, for them to be able to just drop off some pediatric crisis at one specific location. And that's available in San Antonio and other locations where you have one location that just is specifically assigned to these kind of things. And so one of the things that they asked us to do was to call our local legislators, whether it's Senator Zapatini or Richard Bremen, one of the representatives, and ask them to promote a push and advocate for that. And so that's where we are with that. I don't know if anybody had an opportunity to call their local legislators on that. I think what's probably most convenient is that for me to produce a letter where it can be like mass produced by, and just, you won't just have to sign your name or change the area where it says name and who you are, and so that you all can send that letter to either for both legislators.
Excuse me, can I add to that? And as a local police officer with the Laredo Police Department, I just wanted to add, can I speak?
Yes, absolutely.
So I've been a Laredo police officer for 5 years now. Just so you're aware, just to add into what you said, it is a big issue that we're going through. What you just said, when they go through a mental crisis. Sometimes we do have up to 3 to 4 patients at doctors, 3 to 4 patients at MMC, and not only that, but like you said, because the patients are a danger to themselves and to others, an officer needs to be with that patient 24/7. So say we have 4 patients at doctors, 4 patients at MMC, that's 8 officers that need to stay at the hospitals and are not able to, assist and take calls and help the community out on the streets. I just wanted to add to that because it is a big issue that we are working with that. We do have the mental health unit, but they can only help so much. And like you said, if there isn't any beds available in the Catlin or San Antonio, sometimes it does take several days, just like to add to what you said, which, like I said, it'll be several days of police officers at the hospitals waiting until they're turned over to the sheriff's office, or the ones that do the transportation from the local hospitals to the other cities, right? So I just wanted to ask that.
Thank you for sharing that.
Mr. Chair, if I may, maybe just the letter that you, or somebody can write, and then just blue ribbon committee, from all of us, and that will have an impact, and just send it off to even, Henry Cuellar. Right now, he gave a grant to Gateway, so let's do it. If the funds are there, I don't see why not, but as a blue ribbon committee, and then we all can call.
That sounds great. Thank you.
Doesn't have the brakes on.
New business, we're gonna do new business now. Item A is discussion and possible action regarding PRC early strategic plan, activity plan for 2020. One of the things that we started doing now is trying to develop a plan of action about what we were going to do this year. Okay? And so, I don't know if there are any updates to this. Do we have any
Have we
updates?
written it?
No.
No, I think we were all just putting our ideas together. I think the next steps are to put on there, solid what those goals are.
I think
And
that
then-
the vision and the goals, because I tried, we're doing that at
Sure.
LISD, so we need from Erica, the vision, our mission, that's how it starts. Do we have it?
It's on the website.
Yeah, that's on the
Okay, so then
website.
I'll get it from there, and then I'll start formulating one. It's a 5-year plan. Yeah. Yeah,
For
for our
sure.
next meeting, we can have a hard copy of something.
Yes,
we'll
and that
just-
way we'll know what
Well,
the strategic plan is.
And then whoever, of course, on the committee has
those ideas or any strategic plans that we should include so we can look at them, agree and
So,
vote on
so
them.
do we wanna do that here, or do we wanna do that in a subcommittee?
I think it was.
And then
What do you want to
and then
do?
you bring it
So
to, you bring it to the main
bring it-
committee.
Yeah.
You want the burden of having to do it all yourself?
No, of course not.
Yeah, we can do it
No,
separately.
I can do it.
Over lunch.
We can do it.
Right?
Over lunch.
Yeah.
So who wants to be on the committee?
I can be
I
on
mean,
that.
the most creative minds there.
Okay, that would be all of us. All of us, sign up, people.
So,
we'll do it.
it's four?
Yeah, and I'm sure, I mean, Dr. Rutherford possibly, I don't know.
So putting up the Sanchez.
Can we also volunteer?
Yes.
Or is it just?
No,
No, I think you should.
No, if you want to volunteer.
It's anyone who wants to volunteer.
I'm looking at people.
Left side of the
The
room
school
is not being
districts can
represented.
volunteer. Yes. VR should volunteer.
No, we're fine.
I'll have a conversation with Carlos.
Yes.
Yeah, bring them in.
I think if individuals that are, from different organizations come together, I think we can create a plan that is more cohesive and, provides resources, because some are incoming resources, some are going resources, and I think that's strategically important.
I think we need to get Eric in here. Eric from the
Yes.
CL.
So last meeting I had suggested to start a shareable document. I just did, I'm pending the feedback from the committee members of what maybe the areas of focus would be. We could provide the shell, put it in a shareable Word document so that you guys can start editing it and having a hard copy for next time. I'm just pending that information so that we can
Yeah.
plug it in and send it out.
Once we meet, Erica, right, and have that, then we can feed that to you and we can begin that, that's great, sounds good.
And then, I would encourage the committee to also look into the governor's committee on people with disabilities. I'm pretty sure they have their goals and objectives, and if we're able to align with, state, vision, perhaps that would also benefit and, you know, align with support that might be available. There's a governor's committee. Yeah, they need
And then for the chairs with.
and then I think, Andy shared the information we got from their newsletter.
So do we wanna set a date when we can meet?
I have flexibility except Wednesday, except Thursdays.
Yeah, what day works, so we can set
My
a date.
first week is usually free. Thursday, the third Thursday,
So the second week, on a Tuesday, no, I can't do Tuesday. You know what, I'll share my calendar.
Yeah, let's collaborate, look at our,
Yes, yes.
we can start an email thread, right, or, yeah, or even a text, a group text.
Yeah.
Where we're all on it and we can decide what day works, right?
We need before the next meeting for sure.
Yeah.
I'll just caution, if you are going to have membership that accounts for a quorum, if you could let us know the meeting day and time so that Angie can post.
Oh, that's true.
Because that, we need to abide by open meetings.
There's one, two, three, four, five is not-
Get it to
Five
six.
is not a quorum.
Fine.
Five is
That's
not a
not that
quorum,
short.
but then we'll be five.
And not to discourage participation, we just need to abide by our process. Broken. Yes. The wind, so.
So the next item is, discussion and possible action regarding the enforcement of the city's policy regarding membership attendance, absenteeism, and removal. Okay, so this item's here specifically because we had gone back and looked at some of the membership, and I think, I thought it was 3 absences or more, but 3 absences, but I was told that it's 4 absences.
Within the calendar year.
So within a calendar year, if you have, you're absent 4 times, Apparently there's not even a discussion, it's just, you're just removed from the committee. So I just make sure that everybody is aware of that, and you make an effort to attend and be present so that that won't count against you.
So I have a question.
Yeah.
Does that, mean that we cannot attend on a virtual meeting if we had to be out?
I think a virtual meeting counts as long as there's a quorum here.
Okay.
Okay.
Correct.
But you don't know for sure.
No, I think.
No, I'm yes, that's it.
Oh, I'm just verifying on occasions I have to be out and so.
And maybe you move this item forward so that we can, this is it.
Yeah.
Yeah, maybe send an email to every single member and stating the fact about, how many absences, or they can be online, things like that, and get it to everybody, make sure that everybody reads it and that we verify that we read it, and then from then on, it's like, you were told in the email, and that was it.
The only issue with the virtual is that there cannot be 5 members here and the one on TV, or the virtual is the 6, and that counts for a quorum.
They can't.
Quorum has to be made of 5 live human
Yeah.
beings here.
So if the quorum
Okay.
isn't met, then the
Present.
meeting is not an official meeting, correct? So does that absence count?
It's not official.
It does count.
It
Well,
does.
think about it, because if you're not having
So
a meeting, then
if
technically.
someone that's virtually present is absent.
No, if you guys don't meet quorum,
Yeah.
like those absences are recorded to city manager, to city secretary.
So be here.
I'll try.
If there's a meeting posted, if the agenda is posted, we record attendance for that meeting, whether or not quorum is met.
I have a question. Who qualify as a member committee?
They're recommended, or they're appointed by the mayor.
No, that's not true. So there was a discussion during this presentation that was done by the city, that if you've been here for more than 8 years, you're out, okay? And that only occurs if you have concurrent, like if the same mayor is here for 8 years and he assigned you, you're like going on year 9, okay? But if there's a change of administration or party.
I'm still pending clarification from city secretary. I could not get a straight answer about memberships, particularly for this committee, because you do not have terms, and this circles back to establishing those bylaws, making that finalized and official. Because there are appointments by the mayor, yes, there's a change if there's a change in leadership, then you get reappointed by the new elected official. However, I'm still pending clarification on membership terms for that, being that was news to all of us during that training. So we'll let you know as soon as we know.
Something to add to that email on attendance.
Todos fuera.
I'll be the only one here, you all, I'm brand
I'm
new.
curious, how many years have all of you served on the?
This is my third.
I would say 9.
9?
Yeah.
Wow.
You didn't start, you were a founding member, Ms. Susie, weren't you a founding?
You went to.
Well, I want to be, but I
think you were.
Well, I came in right around the same time that Diana came in.
Yes.
And you, 2010, weren't you?
Oh, yeah.
2010?
2000, no, I think I've been here like.
Were all of you here when Mr. Spain was the chair?
No.
I came in
So
afterwards.
then,
We came in when you were here.
How long have you been here?
I don't know, 15 years?
But that was the membership, I do remember saying at the very end, they're gonna look at it again, they're gonna revisit it, because they themselves could not agree
Right.
within the city, so they're
Yes.
gonna look at it again.
So I'll revisit that question with city secretary, but I was pending clarification.
Thank you.
And Ms. Martinez, how many years have you been on the?
As a liaison since it started in 2010. I started when I was 5, if anyone's.
Bring them back.
Soon after I graduated
Yeah.
from high school.
Prodigy.
So if somebody else wanted to join the committee, they would need to wait until there was an open seat.
Is that how that works? I was just wondering, I don't know. Like, we ask somebody, they do.
Yeah, so we've had this discussion, in the past regarding keeping the committee to the amount of members, that it is only for easier management and.
Of course.
Right, yeah, and so that discussion happened here recently, and it was agreed that we would, you know, continue at that. But of course, you all are welcome to join in and, you know, yeah.
Typically it is by mayor appointment. The chair provides recommendations, and he can provide recommendations on memberships, especially when there's a vacancy. As a committee, they could also kind of vouch for a candidate. But typically, yeah, they have to be mayor appointed.
Thank you.
Next item is discussion possible action regarding participation in the City of Laredo Chamber of Commerce Business Development Certification Program on Thursday, April 9th, 2025.
So I had requested for this item to be placed on the agenda. We've been, as Laredo Public Health, we've been in collaboration with the Laredo Chamber of Commerce, in other initiatives, but for me specifically in their business development certification program. So they provide education through monthly modules or monthly sessions, where they broach varying topics like finance, HR, leadership, social media presence, like marketing tips and it's basically targeted to local entrepreneurs, right? Whether they're thinking of starting a business or those local establishments that have a business and want to elevate. This particular module, we are very happy that they want to focus on employing people with disabilities. And we do want to also highlight the work that we've been doing with Laredo Public Health on the All Kinds of Minds initiative. So it's a great platform to talk to employers, to talk to the private sector on the importance of, I know I probably need to find another word, but inclusivity, right? And making sure that people with disabilities have that opportunity. We've been very successful in Laredo Public Health with the programs that Workforce offers, such as the Summer Earn and Learn, any work experience for that demographic. And we have success stories, right, where they have come in and are full-time employees now. I do encourage you all to attend. It will be at April 9th at the Falcon Bank on McPherson, the one that is in front of that HEB on Del Mar. I'll get to the specific details. They build a flyer, they highlight the speakers, they give bios on speakers. I did reach out to Workforce asking for their VR to present, and I'm pending confirmation. So if maybe we have contacts that we can support, again, I think it's a great opportunity to have a captive audience and to really hone in on employing people with disabilities. Also, during April, that's Autism Awareness Month.
I would say.
I'm sorry, they do networking around 8:30 to 9. Usually they get sponsorships for like a light breakfast, and then it goes 9 to about 11. So what I'm hoping is to see, Workforce give a presentation. If you as a committee are wanting to highlight or present or give a message, that would be great too. I have a little leeway with the agenda for that particular day. Just let me know and I could propose that to the subcommittee.
Ms. Martinez,
Yes.
what is the event called?
It's the Business Development Certification Program for the Laredo Chamber of Commerce.
Wait, Erica, I have a question.
Yes.
On the All Kinds of Minds, who's on that committee, or whatever happened with them?
So the All Kinds of Minds is the living document that we have through Laredo Public Health.
But there's no longer a committee, 'cause I
No,
remember.
no.
Okay,
No.
that
So-
was dissolved.
It was somewhat integrated, so I think at one point
Integrated
the
where?
charge to BRC.
Oh,
And at one point, there was the consideration of making a subcommittee that would continue, that specific effort. But right now, we're doing it internally with public health staff,
okay.
and
I
Ms.
was
Carter
wondering,
is
'cause I
taking the
said,
charge.
no, but I haven't
No,
heard
it's
it.
still going, we're still
Yeah,
doing
you
work.
all are
like I
doing
said.
it, okay.
Yeah, we haven't met
No,
the other committee.
yeah, okay.
Where is that, where is that gonna be?
The event is at Falcon Bank at their conference room in the 3rd floor. It's off of McPherson. I apologize, I don't have the exact address, but
Is it
yeah,
Delmar
Delmar and
McPherson?
McPherson.
That one.
I'm McPherson?
Mhm.
Yes, next to Dunkin' Donuts.
Yes.
I was gonna say that. I was going to share, I used to work at Falcon, that was like one of my first real jobs, and when I became a counselor for the blind and visually impaired, we used to have a training for the blind and visually impaired, because we were separate, general services and then blind. There was a specific training class because we had to do outreach, just because the blind and visually impaired population is so like specific, very individualized. And once we completed our it was called employment assistance training, and then part of the final was reaching out to a business, sending out like this very like formal email to talk to them about hiring individuals with disabilities. So mine was going to Falcon, to the HR department. I remember I was super nervous because it's part of the speech and, you know, talking to them, very professional. But I know they were always very open. But of course, for the blind and visually impaired population, then usually where we have some difficulties is we have somebody that's maybe willing to hire, giving to give that opportunity, but then us having that customer and matching their skills and or the type of jobs that they want. And then at that point, we didn't have anybody that was interested in the field of banking just yet, but I know they were very open.
And I'm glad you bring up that point, because with the BDCP modules, you'll get, you know, a variety of employers. So, and again, a lot of them are local entrepreneurs that, you know, mostly small businesses that might not be aware of all the services that are available to them through workforce, or the supports that they can have for a staff member that perhaps is developing a disability. So I think it'll be a captive audience. We saw a good link there. There was just a meeting, city council meeting on Monday, where Councilmember Perez did revisit an update with our All Kinds of Minds plan, and that was one of her directives, right? That we continue to connect with the private sector, continue to develop those partnerships with the Laredo Chamber of Commerce, and we were already working on it in the background, so it's gonna, you know, the timeline of it is gonna look very, very good on us. So, but I'm very excited for the opportunity. I hope you're able, once the marketing materials are developed, I'll go ahead and share with the group. And hopefully, yes, we have some presenters confirmed, because definitely with workforce, I think that would be a great platform.
Is it free of cost?
You have to be a chamber member to attend. City is, so I think a lot of you all's agencies are. If not, you know, I can get clarification from the chamber. As part of BRC, we should be able to try to obtain some consideration.
Thank you. Maybe you can clarify this, it's a certification program, so they're certifying the businesses that are.
The employees, yes. So I went through the program last year. You have to complete a certain number of modules from the total, so it was like 7 out of the 9. And you get a cute little certificate from the Laredo Chamber of Commerce. And again, there was topics on, you know, bookkeeping, like QuickBooks, or cybersecurity, HR leadership. So for this round, since I was in the subcommittee, I was like, what about being inclusive? Well, you know, back then we were talking on that topic. So, so they've made it a module in and of itself.
Okay, so you'll send us additional information before the 9th?
Yes, sir, of course.
Thank you. Item 5 is presentation, reports and updates. Update on public health autism surveillance program by Alonso Olivares.
Yes. Hi everyone, my name is Alonso Olivares. This is the first time seeing me. I'm new here at this committee. I attended last month. The only issue is I had another meeting exactly at 12, so I had to run. But I'm here today, so I'm taking over for Ms. Kathy Chavez for her portion. If you see her, congratulate her. She's been promoted. So she's doing another role now, and I'm taking her place currently right now. So here at the health department, I am an epidemiologist and project coordinator for the Autism Surveillance Division, also better known as the ADAM Network Project, which is a CDC funded grant that focuses on getting the characteristics, the number and characteristics of children with autism and other developmental disabilities here within our community. So that's a big mouthful, but I'm sorry. So really quick, our quick updates we have here is basically some quick context. Last week I was going to notify y'all that the CDC did have a halt in communications based on the new administration starting in January and everything. We had a lot of uncertainties, but luckily nothing's been affected funding wise. The only thing we had was a mass halt in communications where they couldn't talk to us directly. We had to just go through email, and we also couldn't have any group meetings unless it was an emergency. Luckily, towards the end of February, we did establish contact with the CDC, so everything's back up and running. The only issue is it might have delayed some of our results. Like basically, the way our system works is we do a surveillance here, we collect data, we report it, and then a big report comes out that's a national report. And that national report might be delayed a bit, just because of the fact that the journal that we publish in was delayed by a few weeks, and also due to other things, maybe terms we can't use in federal documents anymore, we might have to rewrite some of it. But that's just a little background on that. But the good thing is we are planning on expanding. Our first surveillance here, we covered Webb County, and we cover educational and health sources. This year we are expanding to surrounding counties. So a good victory there is that we have already officially broken out to additional counties nearby, and we have established MOUs with them, and we're collecting data. So we're currently in that process. It was a bumpy start to the year, but we're starting to get the flow. So the good thing is right now, even local, like we have everything happening. It's just we're waiting for feedback and the data to come in. But hopefully around April, maybe late April, early May, we have the actual federal report come in, and we could go ahead and talk about that, and I could share it with y'all, so you guys could see how Webb County contributed to this national effort of understanding the number and characteristics of children with autism in our community. But that's about it for me.
So I have a question.
Yes, ma'am. Yes.
So, because of the halt of communication, that report that was supposed to be given to us in March
Yes, it got delayed.
is gonna be delayed.
Yes, we had a meeting last week, and when we had the meeting, so we have a project officer and there's people above. So we actually had the person in charge of the division show up, and he discussed that unfortunately right now, it's like we have updates, but our update is that we'll get updates next week. So we have a following meeting next week. Yeah, I know, basically, it's funny because, for clarification, we're a network of 16 different sites across the US. So I say national, a lot of people use national because basically the prevalence rate that we come up with based on the data, it's what's shared nationally. So 1 in 36 children and 8-year-olds are diagnosed with autism, right? So you could see that as 1 in every class. But it's based on select communities. Unfortunately, we'd like to have ADAM as part of every state, but that's just not the case.
Right.
Based on funding, but yeah, based on the halt, it has been delayed a bit, and they haven't given us full clarification on when it's gonna go and be fully published. All we know that it's in the process, the pipeline it's gone through. It's just waiting on final approvals and to see if we need to make any changes. So the report might come out, the actual paper, but the front-facing community report, like the booklet and updates on the website, might take a bit longer. But the data itself, hopefully next week we have a meeting and we get a release date, so we can go ahead and share that next time.
And I could just add to the information that Alonso was sharing, and we're very fortunate. I mean, all of the, we've seen a lot of movement out of our ADAM team. I think a lot of you were here when it was only a concept, right? When it was that question posed of well, how and where do we get data from our specific community, and, you know, we were very blessed to identify the opportunity, to secure the funding, to have that support, and I would be remiss if I don't acknowledge the fear that we felt when a lot of this messaging and executive orders were coming out and what the impact was going to be on this specific program. We are thankful that we have obtained some clarification. We do understand now, based on some consultants from Washington DC that are connected with our city manager's office, that the executive orders are excluding people with disabilities and veterans. So yes, we might see some changes in language and terminology, but in the support that, and you know, the programs that we do have, you know, boots on the ground right now, we should remain as is. So and then, you know, a testament to the hard work and really the commitment of our small team of like 4 or 5, right? That now they're expanding to the neighboring counties as well, so we will see that regional impact, and we'll get to have that data. We'll be on the map for that national report coming up.
So everybody here, and only because there's a bunch of new individuals sitting here, do y'all understand what the autism surveillance program is about?
So we participated in it because my son was 8 and you had guys that sent me an email through his school.
Oh,
So
you
from
guys
what-
do someone, yes.
Yeah,
Oh,
so
okay.
from what I understand,
Yeah,
I filled out the survey.
And it's completely, it's basically, it's a, so surveillance sounds very harsh when we use autism surveillance name, but it's an epidemiological term to understand the prevalence rates of children. So we're trying just to get a feel on, you know, what does our community look like compared to other communities around the US? And all we're collecting are specific data elements, no identifiers, just to make sure that we count every child and every child is counted. And we could go ahead and report what services are they obtaining, what, you know, what any other diagnosis and stuff, just so we could have that look into it. And that's how these numbers are generated. When you look at so many people have this, so many people have that, it's through efforts like this, these surveillance efforts. But every day, any clarification, always here.
Alonso, and
Yes.
those surveys are done yearly or just once since you started the?
So it's done surveillance here, so it starts every 2 years.
Every 2 years.
Yeah, so the way I talk about it is, traditionally in epidemiology, you'll see, it's like the moment of, you're doing the investigation, the moment of, a case comes in, you get the case, you have to see if there's an outbreak, whatever it may be. The way we do it is basically it's retroactively, so we're looking the year before. So we have surveillance here, and we look to the year before, and we collect and we give a snapshot of what it looked like in that year. So that's why, and for scientific purposes, because we are working with the CDC and their scientists, it's very specific in ages and timeframes because you need to establish that standard across. So it's been like this. It's the longest ongoing autism surveillance program in the nation. It's been going since the year 2000, and we've been fortunate enough that we've been part of it. So you can always look it up. It's ABDM Adam Network, and that leads to the CDC website, and you'll see all the states that are involved. So currently right now in Texas, we're 2 sites. We're one in Austin, Dignity, and then Florida Public Health. So we're really fortunate that we got chosen.
And the only one on the board.
Yeah, on the board.
Cool. Thank you, Alonso.
No problem. Thank you.
We move on to item B, which is report on family support for children and young adults with special needs program updates by Carmen Andrade.
Hello, everyone. I'm Carmen Andrade. Well, today I do want to share that this month is Disability Awareness Month. And so because of that, we are hosting a disability awareness event. It's going to be next Saturday, March 29th. It's I'll email this flyer to Miss Angie so that she can also share it with you. But we are also having a walk for the Down syndrome. This Friday it's World Down Syndrome Day. So we are also doing that, and we will have some activities, games for the children. for families, and also Zumba for them. So, I do wanna share this event with you all so that we can also share it with the community, and if you can join us on this event, we'll be, there. It's gonna be at Freddie Benavides Sports Complex, from 10 to 12. That's my announcement, and upcoming announcements, well, it's for next month. I do wanna share, like Ms. Erika Martinez mentioned, the all kinds of master plan, minds, I'm sorry,
All kinds of minds.
Yes, in which I do wanna, talk a little bit more next month with you all, and so that we can, together, work and, bring more, businesses to our community, and be able to help expand our businesses and have, inclusiveness, with that, project, but, I'll share more information next month with you on that.
And I guess for context for new attendees, Ms. Carmen is part of our family support program for children and young adults with special needs. She's relatively newer to the project, but known in public health with a case management background. And we work to connect families to resources. So whether it's, to ensure financial, assistance, any type of therapy, just that connection, working with the families, and then we'll continue to expand on that particular project with the addition of a case manager that will support her efforts. So she does a lot of outreach, a lot of education, a lot of those connections, right? Then we'll have that additional support through a case manager that will, really track down and identify the resources specific to those family needs. And the ages are, remind me.
From 1 to 20 years old, 20 years of age. We do help them, into those, transitions to their adulthood. So that is also part of the program, helping the families, navigate that component.
Are we doing anything, are we continuing to do anything with the daycares?
That is something that we're gonna be, bringing up, once again with, project office.
Okay, because remember that, the autism, what was it called? What was it called? The autism coalition. The autism coalition got started because a mom had that concern about there are no childcare facilities for our children. They're not trained to handle our kids, so our kids bounce from one daycare to the other, to the other, to the other, and then ultimately, then parents don't find childcare. So that's still something that's in the forefront, hopefully.
Yes.
That we can work with those childcare, or those daycares and do something about it.
We did do a number of trainings with childcare centers. It's something that we'll revisit. As many of you are aware, we did go through a transition of roles and staff members. So it's just getting Ms. Carmen acquainted with all the functions of not only the grant-supported program, the state grant-supported program through FSCR, but also the initiatives internally to Laredo Public Health, with the backing of City Council and the Mayor. So again, we provided an update to City Council on Monday, and we do have a plan moving forward on the things that we will revisit, and of course, open it up to discussion with BRC on any other activities or goals or focus areas you guys would want us to touch on. I know we did a lot of work with adaptive aquatics, with inclusive recreation. Another success of that is that Parks and Rec has their first disability specialist on board.
So I have that.
So now they're, now they're the power team. And, we gave her some time to get her footing, but we can only go up from here.
And every time it's new, information that comes aboard, so it's getting painful, but I'm more than glad to be able to help you in those concerns.
Next item are announcements, open discussion.
I do have an announcement that I want to share. Our agency, I'm the director for Let's Go Texas, LG Texas. And, we recently were selected by the state of Texas, or by really by UNT, University of North Texas. We are one of 4 providers, Lubbock, Amarillo, Houston, and San Antonio. We work in the San Antonio area with the state-supported living centers. And, UNT and Texas Workforce Commission's got a $12.7 million grant, specifically targeting sub-minimum wages agencies that are called 14C. I was not even aware that 14Cs existed. Those are like goodwill agencies that pay below minimum wage. And our goal and the whole goal of the grant is to find ways in which you can empower, train, and equip agencies and employers throughout the cities to hire individuals with disabilities at above minimum or minimum, at least minimum wage. So we're really excited. We're at the end of year 3. We will be working with it for 2.5 years. It's a research-based grant, so what it's going to produce is going to produce a pathway for other providers to use throughout the state of Texas. And night to shine next year.
Okay. I have 2 announcements. Chair. Our organization is going to have a gala March 27th. We still have 4 tables to sell, so if any of you are, interested, let me know. We are celebrating 25 years of being in the community, and then April 2nd, we will have Light It Up Blue event at the PAC, former Civic Center. LIS the offices now. We're gonna have the kids, we're gonna have Rajids, we're just gonna have a lot of fun. Okay, so you all are invited, but I will send Erica the invitation. Thank you.
Any other announcements? No? Move to adjourn?
Second.